Welcome to Medical Cannabis Patient Ethics and Privacy. Learning objectives. Ethics and patient privacy, along with their legal rights, are a growing concern for the expanding medical cannabis industry, but too frequently, organizations fail to treat it as a significant risk and management priority. Professional persons in healthcare delivery fields have legal and ethical responsibilities to safeguard the confidentiality of information regarding the patients and their care. It is helpful to think of privacy as having two major dimensions: legal requirements that arise specifically from government-level cannabis regulations concerning its medical use, and then requirements that are more generally applicable, but include cannabis organizations that are operating. Cannabis-specific regulations differ between various legal jurisdictions and even within communities, such as requirements applicable to medical cannabis patients and adult-use consumers. Many take an approach to medical user privacy that is inspired by the fairly robust set of standards around health information and laws that govern medical records. It's been long established that the mere fact of receipt of medical care is itself treated as protected health information (PHI), and so similarly cannabis operators are frequently required to maintain the confidentiality of medical users. Learning objectives. Medical cannabis program. Due diligence practices. Medical cannabis versus mental risks. Legal and ethical considerations. Medical provider responsibilities. Data privacy principles. Patient service best practices. Style flexing. Retail dispensary best practices. Verbal communication guidance. Written records guidance. Peers and colleagues confidentiality. Medical cannabis program. Medical cannabis is becoming widely available, and its medicinal use for patients is likely to expand. Despite the increased accessibility and use of medical cannabis, physicians have significant knowledge gaps regarding evidence of clinical benefits and potential harms. Primary care providers have an ethical obligation to develop competency to provide cannabis to appropriate patients. Furthermore, specific ethical considerations should guide the recommendation of medical cannabis. In many cases, these ethical considerations are extensions of well-established principles of beneficence and non-maleficence, which indicate that providers should recommend cannabis only for conditions that have the strongest evidence base. Additionally, the contested status of cannabis in cultures around the world raises specific issues related to shared decision-making and patient education, as well as continuing clinical education. Despite these rapid changes, aspects of the political debate over medicinal cannabis remain entrenched in a discourse that reflects anachronistic moral and political sentiments, rather than evidence-based considerations of how to balance the benefits of medicinal cannabis against potential individual and public health risks. Recent surveys indicate significant knowledge gaps about the effectiveness of medical cannabis among practicing physicians, and although many providers believe medical cannabis can be helpful for patients, a minority feel sufficiently informed to make recommendations. Their training offers little promise of improvement. A recent survey of residents demonstrates that nearly 85% receive no education in medical school or residency on medicinal cannabis. Given the reality of medical cannabis, primary care providers now have an ethical obligation to develop a level of clinical and ethical competency to enable them to recommend cannabis to their patients when it is indicated. This is particularly so because cannabis industry regulators typically establish a list of qualifying medical conditions, typically including terminal illnesses and illnesses presenting severe chronic pain. This is sometimes a closed list created by statute or regulation, or sometimes a more open list subject to the opinions of licensed medical professionals. Thus, the mere fact of participation in a medical cannabis program implicates significant privacy concerns. On the adult use side, privacy regulation is more varied but can be exacting, as some regulators impose extensive requirements on the gathering, use, and retention of medical user personal information. Outside of cannabis, specific regulation Cannabis organizations are also subject to generally applicable privacy laws if they gather significant information about patients. The identity verification and record-keeping practices of most cannabis businesses necessarily involve gathering and holding personal information that is subject to local regulations. Due diligence practices. As with any organization in a highly regulated industry, cannabis companies must contend with the key risks surrounding regulatory compliance relating to their transactions. Such regulatory issues include obtaining and determining the validity of an organization's licenses and permits to conduct operations under the legal framework, particularly because government licensing regimes change frequently and typically issue licenses that must be regularly renewed. But beyond the important question of whether an organization is legally able to operate in a given jurisdiction, the organization's compliance with privacy laws should be a salient part of due diligence. Compliance diligence is necessary to understand and identify any potential liabilities that may arise from past or current operations. Professionals should regularly ask questions and request materials related to data privacy on the following matters. External-facing privacy policies that establish the rights of patients, paying particular attention to the specific laws in the jurisdiction that you're operating, will dictate the contents and implementation of privacy policies. Internal-facing policies that govern the treatment of confidential information, including policies on training and administrative, organizational, and technical safeguards for confidential information. Allegations of noncompliance with data privacy laws. Records of patients' requests to opt out of receiving marketing materials, for example, where the law permits such marketing in the first place, etc. Just as cannabis-specific regulation continues to evolve at the government regulator level, data privacy is one of the most active areas of legislation. Significant new privacy legislation is either working its way through the legislature or has been recently enacted in many jurisdictions in which medical or adult use cannabis, as the regulatory landscape continues to shift. Medical cannabis versus mental risks. Cannabis use carries certain risks. As a psychoactive drug, its effects on behavioral health are especially important to recognize. In particular, cannabis use is associated with increased incidence of psychosis in a dose-dependent manner, major depressive disorder, bipolar disorder, and anxiety disorders. For children and adolescents, the clinical and ethical trade-offs are more complex. The younger the individual, the higher the risk for cannabis dependence or adverse outcomes. Individuals with mental health disorders disproportionately use drugs like cannabis, and it is common for people with drug abuse or dependency disorders to have co-occurring mental health disorders. People with psychosis spectrum disorders frequently self-medicate with cannabis, a practice linked to greater risk of drug dependence, making its use both a self-administered treatment and a potential cause of psychosis. The causal relationship between cannabis and mental illness remains unclear, likely multidirectional, and subject to confounding. There are several possible and likely interconnected causes of these associations. 1. Substance abuse may be a risk factor for developing mental illness. 2. Mental illness may be a risk factor for developing substance abuse disorder. 3. There may be an overlap of predisposing risk factors to both conditions, like genetic vulnerability and environmental stress. These are not mutually exclusive causal relationships, and the multiple associations found between cannabis and severe mental health disorders require prudence when recommending cannabis, especially for young adults and patients with other risk factors. Associated medical cannabis risks. Problematic cannabis use, such as addiction and habitual use that interfere with daily life, while infrequent among cannabis users, is also a risk. In particular, there is evidence that initiating cannabis use early in childhood significantly increases the risk of problematic cannabis consumption later in life. There appears to be a dose response across all age cohorts, that is, increased frequency and heavy usage, are associated with a greater chance of problem cannabis use later in life. For pregnant women and neonates, there is evidence that smoking cannabis during pregnancy can increase the chance of a low birth rate. However, observational studies of cannabis use during pregnancy note a confounding of cannabis with tobacco and alcohol use. While researchers have used a variety of statistical techniques to parse out the effect of cannabis, the data are limited to smoked cannabis. As a result, there is little evidence that tetrahydrocannabinol THC itself is associated with severe complications in neonates. Rather, the primary finding is that smoking cannabis increases the risk of low birth weight. There are other somatic health concerns regarding respiratory function, the risk for cancer, cardiovascular health, and accidental injury associated with cannabis. However, it remains to be seen how much of the risk factor is specific to how cannabis is ingested, that is, inhaled as smoke, ingested in food, or consumed in other forms. The range of modalities of cannabis consumption, the variety of strains, and varying cannabinoid and terpene concentrations all complicate assessments of the risks and benefits of cannabis use. It may instead be useful to conceptualize cannabis as a class of therapies, rather than a single drug with one specific active ingredient. The expansion of legalized cannabis has yielded a range of options for medical cannabis patients and recreational consumers. Cannabis flowers can be smoked. THC can be concentrated into pills, vaporized from waxes and tinctures, or added to food and drinks. Some ingestion methods yield far more potent products in terms of THC concentration, as well as different ratios of THC to cannabidiol CBD and other compounds. Legal and ethical considerations. The ethical principles guiding patient care and treatment with cannabis are similar to any other medication. These include ensuring a favorable benefit to risk ratio, fully informed consent, and careful monitoring for safety and side effects. However, there are also a few additional ethical considerations that become salient to cannabis use, that is related to social context and lingering misconceptions. The principles of biomedical ethics, beneficence and non-maleficence, respect for autonomy and justice, can help to guide cannabis care. To uphold the principles of beneficence and non-maleficence, providers should recommend cannabis only for conditions where the evidence base is well established. These include conditions such as chronic pain, nausea, and symptoms of multiple sclerosis. As evidence accrues that cannabis is safe and effective for other conditions and subpopulations, primary care providers should remain open and willing to prescribe it for different indications. It is important to note that medical cannabis laws differ in what they consider legally qualifying conditions. The variation in recommendation patterns is not well understood, and recent evidence suggests that 85.5% of cannabis recommendations were for conditions with substantial and conclusive evidence of clinical efficacy. However, in some legal jurisdictions, some conditions such as post-traumatic stress disorder (PTSD) are considered qualifying, despite a paucity of evidence for clinical efficacy to date. Because specific jurisdictional laws and regulations may not reflect the current body of evidence, legal and ethical uses of cannabis may at times be in conflict. While it may be illegal to recommend cannabis for conditions other than those specified by law, it is ethically justifiable for providers to do so if available evidence supports cannabis use for a particular patient's condition. Similarly, for conditions where the evidence of effectiveness remains equivocal, providers should not accept legality as the ethical foundation for recommending cannabis. Medical provider responsibilities. Many patients will have prior experience with cannabis. Providers should take this experience seriously and engage in a patient-guided, shared decision-making process. The provider's ability to strike a balance between population-level evidence and the experience of an individual patient is part of the art of medicine. It should not be difficult to apply similar dialectical logic when treating medical cannabis. In some cases, providers may ethically recommend medical cannabis for off-label use for low-risk patients with prior experience. However, given significant changes in the purity and potency of cannabis, a patient's past cannabis use should not be determinative when formulating a new treatment course. Furthermore, physicians must weigh prior patient experience against patient-specific risks, for example, pregnancy or underlying mental health concerns, and available evidence, and must be willing to counsel discontinuation of cannabis use. Primary care providers must recognize the differential clinical effects and adverse risks of cannabis on various subpopulations. Cannabis is differentially effective for chronic pain and nausea in adults and children. Based on the literature regarding the risks and benefits of cannabis, the decision to recommend cannabis to young adults, for example, those under the age of 25 years, ought to pass a much higher evidentiary test than older patients. This is not to say that all children should be denied access to cannabis, but the greater risk of mental health consequences requires caution. Primary care providers should also educate patients about safer ways to use cannabis. 1. The dose dependency of adverse effects of tetrahydrocannabinol THC suggests a conservative approach. While much of the research on dosage is underdeveloped, providers should recommend the use of low-potency THC products first. This is especially important given the increasing average potency of cannabis products over time and the increased availability of highly concentrated synthesized products. 2. Given the confounding of smoking tobacco with THC consumption, providers should recommend against smoked cannabis under most circumstances. 3. Cannabis is available through both regulated and unregulated markets. Providers must take into account the different ways patients may obtain cannabis and counsel against seeking unregulated supplies. 4. Attention should be paid to cannabidiol CBD content in cannabis products. CBD is a non-intoxicating component of cannabis, but a high CBD content results in lower THC content. As a result, many products have little or no CBD in favor of a higher concentration of THC. Emerging literature suggests that higher CBD content in cannabis products may be protective against the risk of psychosis and cognitive impairment. While more research is needed to fully understand the actual extent to which CBD protects against adverse side effects of THC, the evidence to date and the principle of non-maleficence suggests that physicians should in general consider cannabis products that contain a relatively high CBD to THC ratio, unless otherwise indicated. Medical provider responsibilities. The imperative to reduce the risk of cannabis consumption also requires providers to understand the various modalities of consumption. As noted earlier, certain methods of ingestion may alter the potency and metabolism of cannabinoids. At the moment, it seems reasonable to suggest providers advise against excessive smoking of cannabis, or the use of especially highly concentrated tinctures, waxes, and shatter, except in patients with significant experience or serious chronic pain, in favor of lower potency options. The widespread outbreak of vaping-related illnesses, which has been linked to several deaths and thousands of lung injury cases, demonstrates the need to pay close attention to how patients use cannabis and where they procure it. The connection between vaping and lung injury appears to be connected to vitamin E acetate, an additive found in unregulated tetrahydrocannabinol THC cartridges. Providers should follow guidance from the healthcare professionals regarding vaping and should be knowledgeable about the formulations of various concentrates available in their legal jurisdiction. Clinicians are expected to remain current about newly approved medications, new screening guidelines and diagnostic methods, and the reclassification of therapies as ineffective or harmful. For example, primary care providers are expected to update the management of diabetic patients in line with the regularly updated and adjusted American Diabetes Association's Standards of Medical Care in Diabetes. A similar duty to engage in self-education applies to cannabis. Without a comprehensive understanding of what is available to patients in local contexts, it is impossible to manage a treatment plan as physicians would do with any other drug for a chronic or acute condition. Data privacy principles. Medical cannabis patient privacy can be achieved through technical and social solutions. Technical solutions include safeguarding data from unauthorized or accidental access or loss. Social solutions include creating acceptability and awareness among patients about whether and how their data are being used, and doing so transparently and confidentially. Professionals must commit to complying with privacy rules, and organizations should instruct them on how to actively avoid activities that may compromise privacy. Next to technical and social solutions, the third element of achieving privacy is complying with data protection laws and regulations, which involves two issues. The first concern is that legal regulation is slow and thus unable to keep up with the rapid developments of information technology. Legal solutions are usually at least one step behind technological developments. Data privacy by electronic means should therefore be based not only on traditional jurisdiction but also on soft law, for example, self-binding policies such as the existing data privacy principles, etc. Soft law may be more effective than hard law. The reactions of disappointed patients, especially when those reactions are spread by social media, and the fact that non-compliance with governance may result in unfair competition and/or liability toward affected patients, for example, unfair competition by not complying with self-binding policies and/or liability toward patients by breach of contract, etc., will often be more effective than mere fines or penalties. The second problem of data protection has to do with the fact that these regulations are not internationally harmonized, causing severe complications on a cross-border basis, which is the rule rather than the exception in modern business. The International Data Privacy Principles (IDPPs) approach takes into consideration the international data protection standards and focuses on personal data, but can apply to patient data as well. These principles suggest that the three parameters, payment, consent, and data category, should be balanced and combined with international standards, putting them into a set of privacy rules. Organizations in compliance with international data privacy standards should commit to these 13 IDPPs. 1. Comply with national data protection or privacy law, national contract law, and other legal requirements or regulations relating to data privacy. 2. Comply with current security standards to protect stored personal data from illegitimate or unauthorized access or accidental access, processing, erasure, loss, or use. 3. Implement an easily perceptible, accessible, and comprehensible privacy policy with information on who is in charge of data privacy, and how this person can be individually contacted, why and which personal data are collected, how these data are used, who will receive these data, how long these data are stored, and whether and which data will be deleted or rectified upon request. 4. Instruct everyone to comply with such privacy policies and avoid activities that enable or facilitate illegitimate or unauthorized access in terms of IDPPs. 5. Do not use or divulge any patient data unless the organization is obliged to do so by law. 6. Do not collect patient data if such collection is unnecessary or excessive. 7. Use or divulge patient data legally, and only for a purpose related to the activities of the organization. 8. Do not outsource patient data to third parties, unless they also comply with standards comparable to these IDPPs. 9. Announce data breaches relating to sensitive data. 10. Do not keep personal data for longer than necessary. 11. Do not transfer personal data to countries with inadequate or unknown data protection standards, unless the patient is informed about these standards being inadequate or unknown, and agrees to such a transfer. 12. In the case of a contract between the organization and the patient commits to pay for services or goods, inform the patient individually and as soon as reasonably possible in the event of a data breach. Inform the patient upon request about which specific data are stored and delete such data upon request, unless applicable laws or regulations require the organization to continue storing such data. Do not use or divulge content-related personal data. Do not use or divulge any other personal data without the patient's explicit, separate, and individual consent. Do not store, use, or divulge any data unless applicable laws or regulations require the organization to continue storing such data. 13. In the absence of a contract between the organization and the patient commits to pay for services or goods, inform the patient as soon as reasonably possible in the event of data breaches. Inform the patient upon request what types of sensitive data are stored and delete such data upon request when such data is outdated, unless applicable laws or regulations require the organization to continue storing such data. Do not use or divulge sensitive data without the patient's explicit, separate, and individual consent. Patient service best practices. Now that we've covered medical cannabis ethics, patient privacy, and rights, now it's important to review best practices for patient service. We'll explore a form of communication called style flexing that enables you to better hear and deliver what a patient needs. Laws require you to protect a patient's right to self-disclosure, so it's advisable to leave it up to the individual to self-identify as a patient and specifically request assistance. This means you should ensure data privacy and never bring up the person's condition and advise about products, unless the patient indicates that he or she wants to talk about it. This is a smart service that will avert problems before they occur. Remember, the law is very specific about what you can and cannot say to a patient. Here's a quick guide to some traps and how to avoid them. Study it and practice with your colleagues until it's second nature. What they can say. In my experience, patients have said, anecdotally I hear. What they cannot say. I recommend. Buy this. This works, it is the best for. Style flexing. Style flexing is the ability to quickly assess a patient's comfort level and experience, and adjust the way you communicate accordingly. This is especially important with inexperienced patients or first-time visitors to your licensed cannabis retailer. Remember the golden rule of communication. Treat others as you would like to be treated. Well, forget it. To communicate with patients who may be nervous, confused, or in physical distress, it's far more effective to approach them not as you like to be treated, but how they like to be treated. This involves understanding your communication style, as well as theirs, and being able to flex accordingly. Style flexing is a huge topic among communication experts, but we'll give you the highlights so you can think about it and practice it while at work, and in every other relationship you engage in. Try it out and practice with colleagues, since people communicate in 4 different styles. 1. Expressors are easy to read, very social, show emotion, and like recognition. 2. Directors are difficult to read, like to get things done, and need results. 3. Analyzers are non-emotional, very precise and systematic, and like facts. 4. Relators are good listeners and team players, focus on relationships, and go to great lengths to maintain harmony. Think about yourself and those close to you, and try to place them in one of these categories. The better you get at reading others and providing them with what they need, the more valuable and in demand. As you begin trying to determine what categories people fall into, don't worry about naming the styles. Instead, pay attention to what behaviors they are demonstrating. Also, tune into what they are talking about, what's important to them, and the emotion behind their words. Once you have taken the time to observe these cues in others, experiment with flexing your style and see what happens. With first-time medical cannabis patients, begin with the following basic questions. What effect are you looking for? Are you willing to try tetrahydrocannabinol THC, which may cause you some psychoactivity? Are you willing to inhale even if in a vaporizer and not in a pipe or a joint? Are you willing to allow yourself 60 to 90 days to find the optimum delivery system and dose for you? Then guide them to defining their condition. Are they seeking relief from pain, nausea, headaches? Is the condition chronic or acute? Does it happen concerning a particular event, or is it constant? Some patients are more articulate than others, so a little gentle probing will help you understand the condition better. At the same time, be aware that a patient might not want to discuss medical ailments in detail. Don't push them. Instead, ask what they're hoping to accomplish with medical cannabis, and base your recommendations on that. In the same vein, not all patients want to discuss conditions publicly at the licensed cannabis retailer counter, with other patrons behind them in line. Offer to go to a quiet space to talk about such matters. It will go a long way towards establishing trust and patient loyalty. Retail dispensary best practices. Several of the ethical imperatives for managing medical cannabis are direct imports from existing principles, including weighing costs and benefits and patient-centered decision-making. However, the unique legal and social status of cannabis also yields several particular considerations. These issues include an understanding that what the medical cannabis laws consider a qualifying condition may not map to clinical evidence, and a recognition that cannabis is not a simple pill to be prescribed, but a complex class of therapies that must be managed and adjusted in collaboration with individual patients. Product knowledge. Know your products and what's in stock. Be clean. Excellent hygiene is essential, so always wash your hands, especially before and after handling cannabis products, or wear gloves. Clean your nails and be aware that your personal odor, for example, perfumes, colognes, etc., may affect the aroma of cannabis. Be courteous, efficient, and friendly. Refrain from using a condescending tone, especially with inexperienced users, since patients took a leap of faith walking into a dispensary, and a negative experience might turn them off from returning. Be respectful. Your medical cannabis patients, your coworkers, and your products. Keep learning. Being truly knowledgeable will go a long way toward legitimizing you as a trustworthy source among new patients and earning you respect from others in the cannabis industry. Like any other medicine, decisions about cannabis should not be subject to providers' social or political biases or anecdotal evidence. At the same time, medical cannabis providers should judiciously integrate the knowledge of their experienced patients as they develop patient-centered treatment plans for any number of conditions. Primary care providers now have an ethical obligation to develop the requisite expertise to provide cannabis to patients who may benefit from it. Verbal communication guidance. In the case of a medical patient, no one other than themselves has the right to authorize the release of information. In the case of a child, only the parent of record or guardian ad litem has this right. It should be noted that there will be cases, for example, in custody disputes or under custody agreements, etc., in which a biological or adoptive parent has neither the right to know patient information nor the right to authorize disclosures. In the case of a medical cannabis caregiver, only the designated person, that's typically a family member's or legal guardian, has the right to authorize disclosure. Good practice suggests that every patient record should contain a clear, specific, up-to-date, and easily located statement, indicating who has the right of access to patient information and who may authorize the release of such information to other parties. For any release of information other than what's required by law, for example, a subpoena, etc., organizations must obtain a release of information agreement from patients or their designated caregivers. This includes obtaining permission to share information with another medical professional, and it is prudent to obtain this permission in writing rather than rely on verbal assent. In rare cases, courts or administrative bodies with subpoena power may legitimately require the disclosure of confidential patient information. When a legal system serves an organization or individual medical patient with a subpoena, requiring records or other information as evidence in a legal proceeding, typically you'll comply with the request. However, it is often prudent to seek legal advice in such situations. Professionals are prohibited from discussing patients in public places, for example, elevators, cafeterias, staff lounges, restrooms, clinical sites, etc., with others, specifically including family members and friends. A common misconception people have is that if they do not use the patient's name, such discussions are acceptable. But this is not true. Any description of or comment about a medical cannabis patient who is being served constitutes disclosure of confidential information. The same restrictions that apply to face-to-face conversation also apply to digital and electronic forms of communication with professionals, colleagues, and friends. Written records guidance. Written records have durability and reproducibility distinct from spoken information, so there are additional concerns about the protection and handling of paper files or computerized records. These concerns and challenges have become more complex and intense as a result of the digitizing of information. Breaches of confidentiality can occur as a result of the way records are created, stored, or transmitted. Ordinarily, professionals should not create, update, or store records on their electronic devices, for example, computers, cell phones, flash drives, etc., or personal online accounts. If an organization is aware of and allows such off-site handling of records, then privacy safeguards, such as password protection and anonymized patient identifications, should be meticulously observed. Records on portable devices should not be opened and read in public places, such as coffee shops or on public transportation. All organizations should have clear written policies concerning patient records. These policies concerning records management should typically address record accuracy and content, record storage, both electronic and paper, records ownership, record access, both for personnel who may read and manipulate the record, and concerning rights of access by patients, record review, retention, and related statutes of limitation, information transfer, including transfer by electronic means, handling information request procedures by someone other than the patient or the patient's representative, records destruction, material removed. These policies should be observed without variance. Failure to comply with the requirements designed to protect patient records not only puts patient welfare at risk, but also makes the organization vulnerable to ethics complaints and legal action. It is particularly important for professionals serving patients to be aware of who owns their medical records. Usually, in a medical setting, the medical facility owns the record. In a private organization, the individual who is legally responsible for the operations owns the record. It is important to be aware of what information is necessary and appropriate for inclusion in the patient's records, and to exercise professional judgment in handling patient records. Appropriate steps must be taken to ensure the confidentiality and protection of electronic and computerized patient records and information. All information should be password protected, and only authorized persons should have access to the records and information. Computerized records should be backed up routinely, and there should be plans for protecting computer systems in case of emergencies. Peers and colleagues' confidentiality. Issues of confidentiality also arise for your peers and colleagues as a result of information that is obtained, as they serve in roles within the medical cannabis industry. All of these roles allow access to peer information of a personal and confidential nature. Individuals will uphold the dignity and autonomy of the professions, maintain collaborative and harmonious interprofessional relationships, and accept the profession's self-imposed standards. Information about colleagues and professional peers that is gathered or revealed in the course of interactions with medical cannabis patients should be treated with the same care and respect that are appropriate to that information. When a colleague shares sensitive information, or when one participates in discussions that contain sensitive or controversial matters, professionals should clarify in a candid conversation what level of confidentiality is expected, and scrupulously maintain the desired level. Matters that may result in disciplinary action by government regulators deserve special comments. Individuals reporting or responding to alleged violations of codes of ethics or professional codes of conduct are also dealing with confidential matters and acting in a confidential relationship with the adjudicating body. It would be prudent to consider all aspects of a matter confidential until a final decision is rendered. Once a final determination has been reached, the adjudicating body needs to clarify what information can now be shared and what information must remain confidential. Adjudicating bodies themselves typically follow rules of confidentiality, some dictated by law and regulation, some dictated by the organization's internal governance policies and procedures, while the case is under consideration. Concerning the disclosure of decisions by adjudicating bodies, professionals need to inform themselves of pertinent laws and organizational policies. It would not be prudent simply to assume that the outcome can in all cases be made public. Even when the outcome can be made public, it is often the case that earlier filings, testimony, and deliberations must be maintained in confidence. Thank you for viewing Medical Cannabis Patient Ethics and Privacy.